Welcome back to the Victory Education Lounge. I'm your host Maurice, and today we're focusing on a momentous occasion. Delivery Day, What to Expect with Sickle Cell, Part 13. Before we dive into this crucial topic, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more expectant parents with this vital information. The big day has arrived. It's time to welcome your little one into the world. For women with sickle cell disease, Delivery Day comes with unique considerations and challenges. Today, we'll walk you through what to expect, how to prepare, and strategies to ensure the best possible outcome for both mother and baby. What does Delivery Day look like for women with sickle cell disease? This is the question we'll be exploring today. It's an important topic because for women with sickle cell disease, delivering a baby can present unique challenges. But don't worry, knowledge is power, and we're here to equip you with the information you need. We'll be breaking down 5 key aspects of Delivery Day with sickle cell disease. Firstly, we'll look at the considerations when deciding between a vaginal delivery and a cesarean section. Then, we'll explore pain management during labor, focusing on balancing pain relief with sickle cell crisis prevention. We will also cover potential complications that could arise and how to be prepared for them. Next, we'll delve into postpartum care, managing sickle cell disease immediately after delivery. Lastly, we'll discuss newborn screening, specifically testing the baby for sickle cell disease or trait. So, are you ready? Let's dive deeper into what Delivery Day could look like for expectant mothers with sickle cell disease. Firstly, let's talk about delivery method considerations. This decision is crucial, and for mothers with sickle cell disease, it's not always a straightforward choice. Vaginal delivery is often preferred for its natural approach and shorter recovery time. However, it can be a lengthy process, potentially leading to fatigue and stress, which may trigger a sickle cell crisis. This is where the body's demand for oxygen exceeds the supply, causing severe pain and potential damage to organs. On the other hand, a cesarean section or C-section offers a more controlled environment. This method can be scheduled in advance, allowing the mother and medical team to prepare. It can be particularly beneficial for those with severe sickle cell disease or related complications like acute chest syndrome. However, a C-section is a major surgery and comes with its own set of risks, including infection, blood clots, and longer recovery time. So, how do we decide? Well, it's a team decision. The mother, her obstetrician, and her hematologist should work closely together. They'll consider the mother's health, her history of sickle cell crises, the baby's position and health, and the mother's personal preferences. It's also important to remember that while a plan is essential, flexibility is just as crucial. Labor and delivery can be unpredictable. Even with a well-thought-out plan, be prepared for changes based on the mother's and baby's well-being. For instance, a mother may plan for a vaginal delivery, but if she develops a sickle cell crisis or if the baby shows signs of distress, a C-section might become necessary. Conversely, a planned C-section might be changed to a vaginal delivery if the mother's condition is stable and the baby is in a favorable position. In the end, the goal is the same: a safe delivery and a healthy mother and baby. The right decision on the delivery method, made with thorough consideration and medical advice, can set the tone for a smoother delivery experience. Pain management is a critical aspect of labor, particularly for women with sickle cell disease. When it comes to childbirth, everyone's experience of pain is unique, but for women with sickle cell, the stakes are higher. The stress of labor can trigger a sickle cell crisis, where misshapen red blood cells block blood flow, causing severe pain and potentially dangerous complications. So, how can we balance pain relief with crisis prevention? The answer lies in a customized pain management plan, developed in close collaboration with your healthcare team. This includes obstetricians, anesthesiologists, and hematologists who understand the complexities of sickle cell disease. The cornerstone of these plans is often a combination of medication and non-pharmacological methods. Medications used may include opioids, local anesthetics, and non-steroidal anti-inflammatory drugs. Each of these has its pros and cons, and their use should be tailored to the individual's needs, taking into account the risk of sickle cell crisis and potential side effects. Non-pharmacological methods can also play a crucial role. Techniques like deep breathing, guided imagery, and progressive muscle relaxation can help manage pain and reduce stress, lessening the likelihood of triggering a sickle cell crisis. Epidural analgesia, a common method of pain relief during labor, should be considered carefully. While it can provide significant pain relief, it might also lower blood pressure, which can reduce blood flow to the organs and potentially trigger a sickle cell crisis. Therefore, it's crucial to monitor maternal and fetal well-being closely if an epidural is used. Intravenous fluids are another key element of pain management. Maintaining good hydration can help prevent the clustering of sickle cells that leads to a crisis. Remember, every woman's experience with sickle cell disease is unique. What works for one may not work for another. Therefore, it's essential to discuss your pain management options in detail with your healthcare team well before your due date. A well-planned approach to pain management can make a significant difference in the delivery experience. With the right strategies, you can navigate labor and delivery with confidence, knowing that you're doing everything possible to ensure a safe and positive birth experience for you and your baby. Like any delivery, there's the potential for complications. With sickle cell disease, these can take on various forms, each one requiring a specific set of responses. Let's delve into some of these potential complications and how to be prepared for them. Firstly, sickle cell crises can occur during labor due to the stress and strain on the body. This can cause severe pain and complications, such as acute chest syndrome, a life-threatening condition characterized by chest pain, fever, and difficulty breathing. To manage this, it's crucial to have a specialized pain management plan in place, including hydration, oxygen, and pain relief medications. In some cases, blood transfusion may be required. Secondly, there's the risk of increased blood loss during delivery. Women with sickle cell disease can have a lower platelet count, which is vital for blood clotting. This could potentially lead to a higher risk of hemorrhage during and after delivery. To minimize this risk, doctors may consider prophylactic measures such as blood transfusion before delivery. Thirdly, there's the possibility of infection. Due to their compromised immune system, women with sickle cell disease are more susceptible to infections, which can be harmful both to the mother and the baby. Therefore, it's important to monitor the mother closely for signs of infection and administer antibiotics if necessary. Lastly, the risk of preterm birth is higher in women with sickle cell disease. Preterm babies may need special care in the neonatal intensive care unit, or NICU. To prepare for this possibility, it's beneficial to discuss this with your healthcare team beforehand and familiarize yourself with the NICU facilities at your chosen hospital. These potential complications may sound daunting, but it's important to remember that every woman's experience with sickle cell disease and delivery is unique. With the right preparation and a well-equipped healthcare team, these challenges can be effectively managed. Knowing the potential complications and how to deal with them can provide peace of mind on delivery day. After the delivery, the focus shifts to postpartum care. This time is critical for all mothers, but especially for those managing sickle cell disease. The goal is to ensure a swift recovery and a smooth transition into the joyous journey of motherhood. Firstly, pain management continues to be paramount. The body undergoes significant changes post-delivery, and for mothers with sickle cell disease, this period can potentially trigger a crisis. It's crucial to work closely with your healthcare team to manage pain effectively, balancing relief with the need to prevent a sickle cell crisis. Secondly, hydration and nutrition cannot be overstated. Dehydration can lead to a sickle cell crisis, so maintaining fluid intake is critical. Nutrient-rich meals will also aid recovery and provide the energy needed for the demanding task of caring for a newborn. Thirdly, monitoring for complications is important. Postpartum complications can arise, such as infections or postpartum hemorrhage. For mothers with sickle cell disease, there's an increased risk of pulmonary complications and venous thromboembolism. Regular checkups and communication with your healthcare team can help detect and manage any issues early. Fourthly, emotional well-being needs attention too. The postpartum period can be an emotional roller coaster, compounded by the fatigue and stress of managing sickle cell disease. Seeking support, whether from loved ones, support groups, or mental health professionals, can make a world of difference. Lastly, let's not forget about the importance of rest. It's easy to get caught up in the whirlwind of new motherhood, but rest is vital for recovery and managing sickle cell disease. Don't hesitate to ask for help from your support network to allow you some much-needed downtime. Remember, every mother's postpartum journey is unique. Your healthcare team can provide tailored guidance based on your specific needs and circumstances. With the right care and support, mothers with sickle cell disease can navigate the postpartum period successfully, focusing on the joy of their new baby. Effective postpartum care ensures that mothers can recover well and enjoy their new bundle of joy. Lastly, let's not forget about the newborn. The circle of life continues with them, and as they embark on their journey, it's essential to ensure they're given a healthy start. This is where newborn screening comes in. It plays a critical role in detecting if the baby has inherited sickle cell disease or trait. The process is simple and usually conducted within the first few days after birth. A small blood sample is taken from your baby's heel and sent off for analysis. It's a quick procedure, but the benefits are long-lasting. Early detection through newborn screening allows for prompt management if the baby has sickle cell disease or trait. This means initiating treatments and interventions to prevent complications and enhance the baby's quality of life. It's not just about knowing, it's about taking action. And that, dear viewers, is the power and purpose of newborn screening. Before we wrap up, a quick disclaimer. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. Thank you for joining us in the Victory Education Lounge for this important discussion. Don't forget to like, subscribe, and share your thoughts below. Your engagement helps us create more valuable content and reach those who need this information. Until next time, this is Maurice, wishing you a safe and joyous delivery day.